there were some challenges, definitely. Fortunately, none of the issues was with the data set that we have, because the standard data set, which I used to build the model, has been thoroughly sort of cleaned, I suppose you would say. But the challenges were validating these models. So where most models predict one outcome and we're predicting multiple, what we've had to do is we've had to slightly tweak the methodology that you would go through to validate a model. Or in other words, just to test that the model works with data that isn't the data that you built the data set with. So, for example, if you're predicting a single outcome, then what you're normally predicting is the risk. So there's a percentage outcome, but what we're predicting instead is the expected number of outcomes in a time frame instead. So we've sort of had to tweak how that would work. So, for example, one method of validation, which we changed slightly, is called discrimination. It discriminates. It's what it's looking at is identifying the difference between high seizure rate populations and low seizure rate populations, or patients, I should say. High seizure rate patients and low seizure rate patients. So what you do is you take every possible pairing of each patient in the data. So you have patient 1 and patient 2 in this data set. Patient 1 has had, say, 10 seizures. Patient 2 has had 20. Is the model accurately identifying that patient 2 is having more seizures than patient 1? So what it's doing is it's going through every possible pairing, and it's looking at how often is it correctly discriminating between this pairing of patients. And what you can imagine is that in a clinical trial with over 1,000 people, is the combination of pairings of patients is huge. So what we've had to do is, as well as modifying it to discriminate between numbers of events rather than risk of event, we've also had to try and find a way to get this to run smoothly and efficiently, because it's something that can take a long time computationally as you get into the larger numbers. And actually, outside of this project, we're also, well, it's still the project, but we're working on a way to we're working on an R package, so a piece of statistical software that other medical statisticians can use to solve the same problems that we have.